Do you frequently feel like your joints are stiff when you wake up, like you need to warm up just to move your fingers? Imagine trying to open a tight jar, but your hands won't cooperate. That's how people with rheumatoid arthritis often feel. RA isn't just ordinary joint pain. It's a long-term condition where your body's defense system mistakenly attacks your joints, especially in your hands, wrists, and knees. It usually affects both sides equally. If one hand hurts, the other probably does too. This can make simple daily tasks, like brushing teeth or walking downstairs, surprisingly tough. So, if your joints are often swollen, warm, and painful without injury, RA might be the hidden cause. What makes your body turn against itself? In RA, it's a mix of genes and environment. Think of it like a faulty alarm system in your house. You have a genetic weakness. Maybe your parents or relatives had autoimmune issues, but the alarm doesn't go off until something triggers it. Triggers can be infections, smoking, or even long-term stress. For example, Sarah, a 45-year-old teacher, didn't think much of occasional joint pain until she started smoking during a stressful divorce. A year later, her fingers swelled up symmetrically. Her doctor explained that stress and smoking likely turned on her body's immune attack mode on her joints. So while genes load the gun, lifestyle pulls the trigger. How do you know if it's RA and not just normal wear and tear? Picture this: you wake up and your hands feel like they're glued in place. It takes more than 30 minutes to loosen up. That's called morning stiffness, a classic RA sign. You might also notice puffiness in your knuckles or wrists, maybe even warmth or redness. Fatigue is another big clue, feeling tired like you ran a marathon, even though you just sat all day. Some people also get fever or lose weight without trying, and it usually hits both sides. So if you press on the same joint on both hands and both hurt, that's a red flag. These symptoms often come and go in flares, meaning they worsen for days or weeks, then calm down, but ignoring them can lead to permanent joint damage. How do doctors find RA? It's not just one test, it's a puzzle. First, your doctor asks about your symptoms and checks your joints. Then comes blood tests. They look for markers like rheumatoid factor or anti-CCP. These are like wanted posters for the immune system gone rogue. They also check CRP and ESR to measure inflammation. Plus, X-rays or ultrasounds show if joints are damaged. Now for treatment, early action is key. It's like stopping a small fire before it burns the house. Doctors use medicines called DMARDs, like methotrexate, to calm the immune system fast. Biologics are newer precision drugs that target only the harmful parts of the immune response. Alongside meds, gentle exercises and hot or cold packs help. Many feel much better in weeks, but treatment is long-term, like managing a garden. You must keep watering or adjusting medicine to keep things healthy. Can you avoid RA? You can't change your genes, but you can protect yourself. Imagine your joints are like a car engine. Regular maintenance helps it last longer. Don't smoke, it's one of the biggest risks. Stay active. Walking, swimming, or yoga keeps joints flexible and reduces inflammation. Eat healthy, more veggies, fish, nuts, less red meat and sugar, because food can either calm or fuel inflammation. Manage stress too. Try meditation, talking to a friend, or journaling. Think of John, who had a family history of RA. He quit smoking, started walking daily, and eats more salmon. 10 years later, no joint issues. It's not 100%, but you stack the odds in your favor. Prevention is like putting armor on your joints before the battle begins. Science is making exciting progress. Imagine medicine that doesn't just treat symptoms, but stops RA before it fully starts. Researchers are now testing ways to catch RA in the preclinical stage, before joint pain begins. They use blood tests to find high-risk people and give early treatment. Also, new JAK inhibitors are pills that block inflammation signals faster and easier than older drugs. There's even research on tolerization therapy, teaching the immune system not to attack joints like training a guard dog not to bark at family. Another cool, advanced wearable sensors that track joint movement and stiffness, daily helping doctors adjust treatment in real time. These aren't sci-fi, some are already in use. The future of raw care is not just managing pain, but possibly preventing it altogether.